What therapies are being studied to prevent or reduce the severity of graft versus host disease?
It's actually been an exciting time in the field of leukemia because we have lots of new treatments for leukemia that have come just in the last decade after many years of not having a lot of advances in the field. Similarly, in graft versus host disease, they've co-opted a number of different treatments that we have for hematologic malignancies, drugs like ruxolitinib or Jakafi, ibrutinib or Imbruvica, which were approved treatments for leukemia and for myeloproliferative disorders that actually have been shown to be helpful in some patients with graft versus host disease. So there are more and more treatments for graft versus host disease, and I think the other thing that's been going on is more important maybe than treating graft versus host disease is how do we prevent it. And I think we're hopefully more and more convincing people that using post-transplant cyclophosphamide as a component of that graft versus host disease prophylaxis turns out to be perhaps the most effective thing. There have been a lot of studies that have looked at adding one or another new drug to conventional GVHD prophylaxis regimens, and it seems like post-transplant cyclophosphamide keeps coming out on top. So.